Hi everyone. In today's clip, I will talk a little bit about eczema, psoriasis, and skin conditions. Just a reminder that anything I post here is not meant to diagnose or cure anything and are for informational use only. For any health-related matters, please ensure to consult your healthcare provider. Psoriasis and eczema are two different skin conditions, but both conditions cause similar symptoms like discolored skin, a rash, and itching. Psoriasis plaques cause areas of thick skin covered in scales, and eczema causes a rash of dry and bumpy skin. Eczema also typically causes more intense itching than psoriasis. An overreactive immune system that creates inflammation in your skin causes psoriasis. If you have psoriasis, your immune system is supposed to destroy foreign invaders like bacteria to keep you healthy and prevent you from getting sick. Instead, your immune system can mistake healthy cells for foreign invaders, so as a result, your immune system creates inflammation or swelling, which you see on the surface of your skin as skin plaques. It usually takes up to 30 days for new skin cells to grow and replace old skin cells, but your overreactive, so the immune system causes the timeline of new skin cell development to change to 3 to 4 days. The speed of the new cell replacing the old cells creates the scales and frequent skin shedding on top of the skin plaques. Eczema is the name of a group of inflammatory skin conditions. There are 7 different types of eczema. The most common type of eczema is called atopic dermatitis. This is the type of eczema that is most often confused with psoriasis. Atopic dermatitis, often referred to as just eczema, can vary in appearance depending on skin tone. For example, light to medium skin tones, atopic dermatitis may appear as pink or red rashes with bumps and crust. For medium to dark skin tones, it might look dark brown, gray, or purple with dry, small bumps. Eczema can also change in appearance depending on how long you've had the symptoms. Now, eczema tends to present with red patches of skin, often with ill-defined borders, what can be accompanied by oozing, crusting, and mild scaling. The location of rashes on the body is often differentiated between these two skin issues. Although psoriasis and eczema can happen at any part of the body, certain body locations tend to be favored for each condition. Psoriasis, for example, tends to favor the elbows and knees, while eczema is more frequent in front of the elbows and behind the knees. Eczema is also more common on the face and neck compared to psoriasis. Psoriasis, while can potentially appear anywhere on the body, is more likely to appear on the outer edges of the elbows, knees, scalp, palms, lower back, soles of the feet, ears, mouth, eyelids, buttocks, and nails. So with eczema, symptoms most often appear in the skin folds or crooks of the body, particularly along the creases of the elbows, knees, wrists, neck, and ankles. Babies may also get eczema on the chin, cheeks, scalp, chest, arms, or legs. Adults are more likely to have symptoms on patches of skin on their faces and hands. So those with eczema tend to have overly reactive immune system as well, that when triggered by a substance outside or inside the body, respond by causing inflammation, and they are more vulnerable to dryness, irritants like soaps, detergents, fragrances, and certain fabrics, and allergens like dust, pet dander, and pollen. stress can also play a significant role actually in worsening eczema and psoriasis symptoms. So orthomolecular medicine and its application to psoriasis treatment involves using specific nutrients, vitamins, and minerals to optimize cellular function and potentially improve overall health. The cause of ailments mostly comes down to liver, kidneys, and lymphatic system or lymphatic health. The nutrients to help skin conditions include obviously dietary changes, and of course to more fruits and vegetables and whole grains, as well as vitamin D, omega-3 fatty acids, vitamin E, and zinc. One treatment that I know being very effective was with few patients. They started with 1,000 milligram of vitamin C twice a day, and each week they increased it by 1,000 milligram. So that at the end of 5 weeks, they were taking 5,000 milligram twice a day. After doing that for a couple of months, all symptoms had disappeared and they were not even showing allergic reactions to stuff that they were allergic to before. And so like nuts and strawberries and so on. Nothing else in their life had changed, except they were at this point now taking 10,000 milligram of vitamin C a day at the rate of 5,000 milligram with breakfast and 5,000 with dinner. One thing to remember is that when you're dealing with skin issues, they are the first to show up and the last to disappear. The nutrient you provide your body will first try and fix everything internally before it reaches the skin. The skin conditions 99% of the time are kidney, liver, bowel, lymphatic, and spleen conditions. Skin is your third kidney. When the kidney cannot properly clean, skin jumps in, and that is when we see issues in the skin. It is best to use, for example, things like poke root and frankincense creams to help heal the area externally, but definitely you need to clean up internally as well. Going on a watermelon diet for a couple of weeks is a good idea to clear the toxins in general. Olive leaf tincture is also very good twice a day to clear the gut. Also dark grape diet along with herbal teas and water, of course, is a good cleansing method. But the grapes should be extremely well washed, even if they're organic, if you're deciding to do something like that. From a metaphysical perspective, skin issues can be linked to emotional, psychological, and spiritual imbalances. Our skin is a sense organ. Its job is to sense stimuli in our physical environment as well as our internal emotions. Our emotions, especially the ones that haven't been expressed, could be the root cause of the skin problems. It's common in our world today to bury our emotions, and skin issues are the body's way of showing the feelings that you have hidden from yourself and others. You may be hiding your pain from the world, but it is showing itself in your skin. You may not want to show anyone your pain or the feeling you're experiencing. They may be hiding in the depths of your mind, in the darkest closet corner, but those feelings are there, even if you don't want to show them. Skin problems express your true empathetic nature. People with sensitive skin often have the hardest inner voices. You can feel the energy of others. You struggle with differentiating what emotions are yours and what emotions are not. You may be absorbing the emotions of others unconsciously. Your skin is a boundary. It protects you from everything in your environment. Skin problems are your body's way of expressing that your boundaries are weak. Skin issues can be the root cause of emotional boundary issues. You may link your skin sensitivities to things in your physical environment like foods and chemicals, but it may be time to look deeper and discover the emotional component of your sensitivity. There is always an emotional component, even if it lies deep within your family history. Unexpressed emotions are taking a physical toll on your body. So irritation is often an unexpressed desire for things or people to be different, a feeling of being powerless to change things. This can leave you itching to make a change, but feeling agitated when you can't. Itchiness, irritation, and burning are all skin issues that relate to anger. When something in your life is irritating you, that burning feeling of anger may be causing your itchy skin. Hope this has been helpful. Like and follow for more. Be the light.